video is going over a exercise for creating some rib cage expansion, both laterally and backwards or posteriorly. So trying to sort of stabilize the rib cage on the pelvis on the rib cage, and then creating some 360-degree expansion and pressure and posterior opening. So some different levels. A supported level with a chair or a bench is going to be sort of our first level, and we're going to use something that we can push off of. So you could use the side of a dresser or the edge of your couch, or ideally a wall, so something that's not going to move when you push into it. So you're going to set yourself up lying, and you want to be away and far enough away from your object that you can push into it with a little bit of elbow bend. So find that distance there. This is going to be an isometric, so a non-moving effort from our arms. So I want to be able to push into the wall like I'm pushing the wall away from me, at the same time as dragging my arms up the wall. So the motion is sort of that. And this helps to engage our latissimus dorsi, our lat muscles that are attached all the way down at the bottom of our pelvis, or the back of our pelvis. So we're going to have our fingertips pointing at the ground and a soft bend in our knees as we push into the wall. So you can see how I move a little bit, I push into the wall. And then we're going to try to bring our rib cage down over top of our pelvis. So just by having your feet up on the chair, it's going to bring our pelvis into a fairly neutral position. So this would be out of neutral, and this would be out of neutral. So finding this neutral position from our pelvis, and then we're going to use an exhale to sort of bring our rib cage down and over top of our pelvis. So, and the goal of this exercise is to maintain this pelvis over, or this rib cage over top of pelvis as we breathe. So the breath is going to be going down into the floor and laterally, as opposed to up just here. So the anchor in the wall is going to help me with a little bit with that. So I'm going to find this rib cage position, push into the wall like my hands are dragging at the wall, and then just focus on breathing without losing that rib cage position. Now, if you can maintain that position, taking away some support with the legs, so lifting one leg and lifting the other, you can see how my effort's gone up now. I'm shaking. Trying to breathe into the floor and push into the wall. Now, there's a progression where I could maybe take the chair away and move my legs, but I would only progress to this unless I could keep this. So let's recheck. Exhale. Find this neutral pelvis, so rib cage pelvis connection. I'm going to push into the wall and pull up the wall. Start my breath, and then I can take away my support. Now I would know if I'm losing it if my breath started to come like that. So if my inhale started to lift my ribs up, and now I'm creating some space here. I'm not trying to crunch and use my muscles and core to push into the floor. I'm using my inhale to push into the floor. And if I can maintain that, then I could add a leg movement. And I could have someone come around here and try to peel my hands off the wall. I would not let them. I'm pushing into the wall. Now I can feel I'm starting to lose it a little bit. So I might not be quite ready for that many reps of the feet elevated. But there's a feet supported either on the floor or on a chair. And then we can take away the support, either one leg or both, and then we can add some movement. All while maintaining a rib cage over pelvis position and breathing into the floor while maintaining this pressure into the